Historically, medical technology has been what our advances in healthcare have been driven by. And thanks to the proliferation of medical devices and pharmaceuticals, we're all living longer and healthier lives. But there's a problem here, and that is it just costs too much, and we can't afford it anymore. And in fact, the benefits we're getting from huge expenditures in these areas are getting smaller each year. What we need these days is to figure out how to deliver the same quality of health at much lower costs. What that means is that instead of technology-driven innovation, we need to innovate in the way we deliver services. We need innovation in healthcare delivery. That's the challenge for the next decade, or possibly even the next few decades. So some people may not be aware of what reverse innovation is. It is quite simply any innovation that is adopted first in the developing world. Now, historically, there haven't been too many examples of reverse innovation, which is why it has that name. Most innovations are adopted first in the rich world and only later are adopted in the developing world. But we're seeing more and more examples across lots of different industries of it working in exactly the opposite way. And that's going to happen in healthcare delivery as well. And it makes perfect sense. If we want to figure out how to deliver the same quality of life at a drastically reduced cost, why wouldn't we study what's going on in nations where the resources are even more drastically constrained than here at home? There is lots to learn by studying places like India and Africa and Brazil and China, if we only have the humility to go look. One that people are talking about a great deal these days is surgical operation in India, Aravind Eye Care, where they figured out how to deliver far more surgeries at very high quality and much less time and much lower cost, simply by rethinking who does what in the process of delivering a cataract surgery. A lot of the ideas in healthcare delivery are not that complicated. It's the implementation that's hard.